So often when you ask patients why they're taking some medication, they've forgotten. They really don't know. And over the time that they've been taking it, they might have changed GPs and the handover might have not been all that great. And so often the doctor isn't even fully aware of why something was even commenced in the distant past. So that often creates a problem because people get quite reluctant to stop something that someone else has started.
We see that with poor handover from the hospital as well,
Yeah.
where people might have had a prolonged stay and it's really unclear as to the rationale for why something's prescribed. And so if the doctor doesn't have much idea, it's unlikely that the patient does either.
Yeah.
And often after an acute event, you'll often see people who are prescribed something by a specialist who says you have to take this for the rest of your life, without really considering what that means. And that's a difficult education issue, really, to find out why they're on it, why they're still on it, what would be the consequences of stopping it.
Yeah.
And the more information, the better.
Yeah. Yeah, and the problem with that is that the more medications you're on, obviously the more interactions there are, and then you throw in a few over-the-counter things, and, you know, the only thing I remember from my pharmacology is once you're on 3 or more drugs, no one knows what's going on. So it really is difficult to work out what's going on. You just have to go on the symptoms the patient presents with.
And indeed, some of them may be side effects from the drugs that haven't been recognised up until now, which is a really important part of the process. I think that pharmacists are very good at identifying those sort of potential problems, which is really helpful. And
that's why you know, with us, with pharmacists at least, everything that's wrong with the patient is to do with the drug until proven otherwise. So, you know, we know lots of drugs that could cause a particular symptom. You guys know lots of diseases that could cause a particular symptom, and sometimes one is right and sometimes they're both right and sometimes the other's right.